Hello, Assalamu alaikum and good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Okay, today we're going to bring a subject to you that we have discussed before on the program, but there's just so much knowledge, so much information, so many, advanced treatments that one program is never enough. So today we're going to talk about infertility, and that is something that when it affects a couple, for them it is something that they really want to have children. What are the problems? How is it diagnosed exactly? What treatment needs to be done? All these things are so important. Then there are so many myths and facts, and we want to sort that out so that people who are watching, who it does affect, they can find some answers there. We're very happy to have with us in the studios today our guest, who is Dr. Syed Sajjad Hussain, who is the CEO of Australian Concept Medical Infertility Centre, also a member of the European Society of Human Reproductive Medicine, as other things. Thank you very much, Dr. Sajjad, for joining us here today.
Thank you very much.
Okay, now, Dr. Sajjad, there are many things. We're talking about the subject of infertility, but then, of course, we have to bring into fact many other considerations. There's a cultural, thing as well. When we see in our part of the world that many times, as soon as a couple have got married, everybody's sort of, waiting for them to announce a pregnancy. So how often do you get, newly married couples coming to you, and what do you tell them?
Yes, it is an issue in our society, when generally still a large part of our society is family-based living. They live together with parents, and when they get married, the expectations in the family is too high to have another child, and that is what particularly females are very much interested into these areas, and they keep probing the newcomer that any good news, all that.
Yeah, exactly.
And this literally brings a pressure on the girl.
Right.
And the couple, initially it is the female who is on the face, who is getting all the attention and questions, and the male is generally away from home, working somewhere and coming, but the female has to spend the day. And most of in our culture are non-working women, and they live in the house, so they have that issue with them, and then they confide with the husband, and gradually I think they have the courage to at least visit someone for medical advice. Initially, what we see in Pakistan is husbands are not cooperative, they are stubborn, and they would not agree to any medical solutions. So that is another issue with the female faces, and most of the time I have found, surprisingly, Shabnam, that when they come to visit their mother,
that's
girls,
when
they come to us, and they just have a talk, and when we tell that we will only start the treatment or anything, we cannot advise without the report of your husband, it becomes another problem for them. And we tell them that if you can make your husband talk to us, so I can convince him of how important it is to have his report done and his semen analysis done, because what you're stating is that you have a regular menstrual cycle every month. So I don't need any test at the moment from you, because for me, you are considered a normal ovulating girl. You are producing an egg every month. You are having a regular menstrual cycle. So I have to exclude first your husband, and then I can give you any medical advice. So that is how we begin.
Right. Yes. Okay. So now that's easier said than done, isn't it? Because when you said that many times a girl will come to you when she is at her mother's house, or she's confiding in you that this is the problem right now, and the husband is not willing to come and seek any investigations. So, you know, especially in our part of the world where men or husbands, they can sort of weave in a sort of insecurity about their masculinity.
Yes.
So how do you deal with that?
I think with passage of time, awareness is spreading. But as far as if we will give my comment about that, how much awareness is there in the society at the moment about infertility, management of infertility by the couples, I think it's still a long way to go for male partners to understand it. But generally, it starts, I think, with somewhere from their own area where they live, and they go to some doctors or somewhere, and it is a pretty long time they take to report to a tertiary and center like ours, because we are at the specialized care units. So they start with their family doctor and all that. But yes, male partners are difficult to really convince them and handle, and some of them avoid. And somewhere, we have also found this going on, that the male partner had the reports and they don't want to disclose
and they concealed them.
They conceal it.
Even for the marriage?
Yes. And they take other, excuses not to visit the doctor.
Right.
So this kind of activity goes on, I think. It will be much better if they are facing a consistent dilemma of infertility, that they should visit a tertiary end institute which is only dealing with infertile couples with infertility, and get an expert opinion for their solution. Yeah,
of course.
Yes.
Having said that, there's also the danger then for people not going to see a proper doctor or a proper specialist, and then relying on the other sort of treatment that is available, that somebody's maybe aunt has suggested or somebody's uncle has suggested or whatever, and falling into the other categories and the quacks and that. So tell us about that, what harmful practices there could be there and how that could damage.
It is terrible. It is terrible, and it is too prevalent. Problem is that it is too much there. And that is the reason so many quacks exist, and they're doing their business, and they're doing pretty good business. I mean, sitting and misguiding people and mistreating
and making
them.
their symptoms worse.
Yeah. Of course. And I've also seen this trend, people not following the advice and taking advice from the right person, that is a scientist, a doctor,
a specialist,
but they would seek it from somewhere, from their relatives or some friend, and they will share some experience on a hearsay of someone, and that person went to Flana place, and it was on that mazar or unwan. They had a mannat and something like that. And something like this, and these stories, and they follow those advices more credible than rather having a scientific approach. And that, I think, probably I would relate it to lack of education. Lack of education.
Right.
And that is how it is still in practice, and it does affect them very adversely in the end. At times, there are drugs which are not to be used consistently. They are prescribed even by some of the doctors or quakes at some level. We should be handled with caution, and they should be followed with what is really advised to do. So there is a drug like clomiphene citrate, particularly, which is given very often for improving ovulation of a girl, and but it's very clearly written on the prescription that don't do it for more than 6 times. 6 cycles you can do it. And some
and
girls,
that's written in the medical
yes, it's also in the
So you know that's a way that a person can also educate themselves. That if you are prescribed anything, do have a look at the leaflet.
Yes, leaflet. That's very important.
Yeah, do look at the medical information so that you can also counter check.
Yes,
yeah,
it's very essential. And now information technology has brought a tremendous breakthrough. We have got internet, you've got mobile phones, you've got all sorts of things to approach.
We've got
and find
Google
out
that
facts.
sort of makes everybody into a sort of a
yeah, you can at least have basic information.
Basic information
on
That's
any
true.
issue, rather than you can get it interpreted from you know, an expert. Yes, but you can have an idea
exactly
what you are doing,
and you can discuss that.
Discuss
you know,
it,
this
yes,
is what I found.
Yes,
this is a
absolutely.
reputed source.
Yes,
Please explain this to me.
Absolutely.
I think there's no harm in doing that.
Absolutely.
Okay, Dr. Sajjad, tell us about the prevalence of infertility in Pakistan, and what other factors? Are there any factors that influence it? Is this genetic? Is this a lifestyle thing? What is this?
I think it's multiple things, I would say, because initially your question is about the prevalence in Pakistan, and then about the factors. Prevalence is, as we say, there's a general standard rule, and we say there's about 15% of couple in a society would face, it's minority, but in a society like Pakistan, where we live, where the population is about 200 million people, and if you take half of them as married, or even say 1/4 of them are married, that is about 50 million people. And 50 million people, the married, okay, some of them will not be in their reproductive age. We can exclude them as well. Okay, we come down and say it's about, I think, once I worked it out, and it comes around 250 couples, 250,000 couples who face infertility in Pakistan. That is what is the Gyanman figure, and they need some assistance, guidance, treatment at one stage of their married life to have a child, and some of them need specialized treatment, some of them need guidance, ovulation, and but they're the ones. And my question is still that do they really get to the right place? Answer is no, they don't. Most of them don't go to the right places. So in the social aspects, sometimes it breaks up into multiple marriages, which we are allowed to do.
Which is again ironic if the problem is with the husband.
Yeah, that is what happens.
Yeah.
I mean, the woman the mother will not wait. She will pressurize the son to get another woman, and the whole blame will go to the female
And then again,
partner.
he will try to have start a family with her, and that won't work.
We get such cases, Once our first case, when it came, he was carrying he reported to us with, I think, 3 wives. And
he kept marrying for the same reason.
Yes, and different age group. And just seeing all those 3 wives, it was very clear to me. The problem is not there, the problem is with the male. And that is what came out when we had the test done. The problem was on the male side.
Right.
So Pakistan, is a growing market in vitro fertilization, that is ART technology, assisted reproductive technology. It is recent, it is from 1978 onwards when we got the first test tube baby, that Louis Brown. That after that, a special focus came on infertility management. And it turned into a specialized area, and then it became a subspecialty. So now it's a proper recognized subspecialty, and gradually there are master's programs and postgraduate training programs going on in this area for doctors, and they're focused entirely on handling management of infertility in a very different way, in a specialized centers and with all the tools. And in vitro fertilization itself has grown over from 78 to 2018. There has been tremendous changes in the technology, in knowledge, in innovations, in equipment, and entire management has changed and information has changed. So more focus is developing towards embryo biopsies and understanding the human genetic structure and finding out diseases there. So it is getting more advanced, but Pakistan is still at the basic end. I think the primary management of infertility needs improvement at grassroots level, at all levels. I think the people also do need an education about the physiology of reproduction. They should understand, a girl who is going to get married, she must understand her evolution process. She must understand about her menstrual cycle.
In fact, that was going to be my next question to you. That before getting married, it's much more easier for a female to identify problems because of her menstrual cycle. What should actually, what would you like to see people being more proactive? Because, sometimes you would get a young couple who come over to you and you find out in tests that there was something that, it was before the marriage, a problem that they had, that could have been, saved time or whatever, or not led to any problems within the relationship. So what are those signs that people should be looking out for?
I think parents must demand before getting their kids married from each other if they can have a medical fertility assessment done.
There's nothing wrong with that.
There's nothing
There's
wrong.
Absolutely, that's a confidence building measure, isn't it?
There are, we end up with couples, beautiful girl, beautiful boy, very good couple, young couple coming to us, and we find the testes are undescended. They will never have a sperm. We cannot produce a sperm at all. And that is the end of the story. We can't help such couples at all. In Pakistan, we go by the Sharia rule, and there's nothing much. Similarly, a girl comes. I remember such a beautiful, cute girl, and she came, and once her ultrasound and reports were done, and I found that her ovaries are so small, and her entire structure of the reproductive organs is so distorted, congenitally, that she cannot become a mother. And such a tragedy. Now she's married, already they're married. So these things, if the people are aware of such,
they need to tell each other.
And they know in advance. So these tragedies
can be averted that way, because of course then a person, if they're in a relationship, they can then understand that how things are going to go forward. Say it's not an arranged marriage even, it's where the boy and girl know each other before they're getting married.
Absolutely.
The parents need to, everyone needs to come clean, because whatever it is, if there's an issue, it's going to come to the table at some time.
Yes, it has.
So
you can't hide it under the carpet.
Exactly.
It will emerge. It will emerge, yes.
Absolutely, okay. Now, we will come to common reasons of infertility and the treatment. I wanted to ask you, as I asked you before, that lifestyle and the food we eat and genetics, how much of a role does that play? Is there anything we can do to make sure our children are sort of like more healthy before they get married, and things they shouldn't be doing? Like we hear a lot about milk, being the buffaloes being injected with hormones and things like that. How much is fact? How much is fiction?
I think your question is very relevant. I'll make it more directed for public. There is every fifth girl is suffering from polycystic ovarian syndrome.
This is Pakistan?
Internationally.
Every fifth girl.
Every fifth girl.
That's a huge number.
Every fifth girl is suffering. And in Pakistan, maybe every fourth girl.
Every fourth girl.
Yes, every fourth girl coming for infertility is suffering from PCO.
Right.
We call it PCO.
Polycystic
polycystic syndrome. Polycystic syndrome is shrouded in mystery still. You know, it will be a multiple factor etiology. It is genetics. It's got hormonal imbalance. It's got so many things, but mostly what you are just saying about lifestyle, you're saying about all these things, the milk with the steroids, or the chicken we eat is full of steroids, that we know for sure in Pakistan, it is full of steroids. Disbalances, it gives more androgen, more testosterone, more hormones to girls. They gain weight very quickly with this kind of food, and they also tend to have more appetite. And these things lead to the PCO is a big cause of female infertility.
Right, okay. What are the symptoms? Because we'll have mothers watching, we'll have girls watching as well. So if they have those symptoms, they should get themselves checked out. What are those symptoms?
First symptom would be gaining weight.
Gaining weight, okay.
Yeah. Hirsutism, that is hairs at abnormal places of the body.
Right.
Yeah.
Facial hair as well.
Facial, hands.
Okay.
And you know, and the biggest sign for a girl is nothing, irregular menstrual cycle. Okay. If she misses her periods and begin to miss her period, a young girl in a reproductive age, that is an alarming sign.
That's an alarming sign. So, you know, mothers have to be vigilant here, daughters as well, girls as well, you know. If this is going on, you have any of these symptoms, then you need to get yourself checked out. And where should they go? To see a gynecologist? Or a
PCO, I think there's a lot of awareness, but I think it needs still good management, combination of endocrinologist plus gynecologist.
Okay.
I think that should be the way forward.
Right.
And lifestyle changes will make a lot of difference.
Right, okay.
Yes, yes.
So
yes,
we'll get back to this. Right now we have to go for a break, but don't change the channel. Okay, welcome back to the program. Dr. Sajjad, we were talking about polycystic ovaries.
Yes, I think as its prevalence is very large in our population as well, I think the parents and the girls, both need to know it. Generally, it emerges after the marriage for girls, because once they get married, they start when the question of baby arises. But I think it's much better if they are aware before marriage as well.
And get treatment before.
Yes, and the parents also know there is a problem. The first sign, as I earlier said, that it would be missing of a menstrual cycle. That can be one symptom. Hairs at abnormal places on the body is another symptom. The third symptom is gaining weight. That would be another sign. And if all these combination and missing a period,
right,
these all would combinedly lead towards they should understand the problem is there, and probably it will be polycystic, but they need to get it diagnosed.
Right, and it's diagnosed by an ultrasound?
It can be by hormonal, there's a hormonal assessment done in which there's an LH and FSH ratio, which doctor will of course find it out. And ultrasound has got two pictures, you know. At times it's very typical polycystic ovary, and there are a lot of cysts, and the follicles are all around, set around the periphery, and you get that immediately the sonologist would know it is, and they can write it down, it is polycystic ovarian syndrome. She is suffering from that. So that's a typical picture. Sometimes this picture may not be there, but still she can be PCO. Right. So it is not that someone
That's not the only defining diagnosis.
I think
it needs
one should not make their own conclusion. It will be, let the experts do their job.
Yes.
And I think they need, if they, many girls I have seen, 5 kg loss of weight has helped them conceive, you know.
Oh, this is very, very important then.
Yes,
are we just talking about polycystic?
Yes.
Right, okay. So what Dr. Sajjad is saying here is that's really important. If you are polycystic, just 5 kilograms, losing those 5 kilos can actually help you in conceiving. So
absolutely.
that is
absolutely
not too hard to do at all.
Yeah. I tell you a very interesting case. Once it came to me, and she weighed 120 kg, the girl. And she came through a program, you know, which I was supposed to give her a free treatment, basically. And was happy to do that. And once I saw her, and I saw her BMI, basic body index, and body mass index, and also saw her weight, I said, it will be dangerous for you to become pregnant, because once you, with this weight, you carry a baby, and your blood pressure is already.
Tell us about the ladies who are overweight and who what are the dangers for them?
Yeah, I mean, weight for anybody, I mean, including me, particularly those who are in the reproductive age, for them, and those who are going to bear a child, for them, weight can add to many complications, even pregnancy. So keeping low weight, keeping fit, and having nutritious diet, and having some physical activity is very important for their life. And that girl, you know, I just advise her to lose weight, and she just lost 10 kg with lot of effort, and she conceived naturally.
Without any assistance?
Nothing. We didn't do anything. She conceived at home after 11 years, I think. That
After
was
11 years. Imagine
that was just 10 kg gone, and her ovulation became all right, and she conceived. And she has a beautiful son. Yes.
How wonderful. So, I mean, that's it's so lovely to hear stories like that as well. Without any assistance, it was just the excess weight, I mean, 10 kilograms that she lost, and she was able to conceive. Okay, so what's the treatment for PCOS then?
PCOS, I think the biggest treatment is this, what we are discussing, is weight loss. Without any cost, without any money.
Oh, yeah.
Without
and overall, because then that's just not, as you said, it's not just the, you know, the aspect of the fertility, it's the overall health of the individual.
Yeah, of course, of course. You look brighter, you look younger, you are more
feel
agile.
Better.
You can
feel more energetic.
Better, So I think they should focus on their physical fitness, and they can also seek help for hormonal treatment, which there are a very well good regulated regimen which settle them. There is insulin resistance in most of the girls. Is one of the reason they have this syndrome. So many treatments are available. Endocrinologist can help them, and also a gynecologist can help them, and it's not untreatable.
Right.
So,
okay, so that's the good news there. Okay, so let's talk about men now. And we've talked about the PCOS with the women and everything. What about men? What causes can influence their fertility?
I think it's a very important question in our society, and we must appreciate and understand that male are integral part of a married life, and naturally they constitute 50%. And the same 50% they also contribute towards infertility. I mean, it's same ratio.
Of course,
if we just analyze how much fault is with the female and how much fault are with the males, so it is almost same. It is equal, and we see more of it because why?
Somehow we seem to sort of understand. I mean, we seem to perceive that if somebody's not having a baby, it's because there's a fault with the, it's the wife or the woman who needs the assistance or the intervention. That is something that, usually people pick up on.
That is how it is. But you really believe it or not, we see much more male infertility than female. Reason is that the male is the soul, he's the earner, he has the money, he controls the finances, so he is the decision maker. Once he realizes that he has a problem and it's not going to be solved, so he comes over with the decision to spend money, and that is, I think, one reason we see more male infertility than female. I think probably many females who are having some problem probably are not brought to our level of treatment. So male factors are multiple, and the biggest is problem arising on their sperm quality, sperm number, sperm mortality, and that is and that can be from multiple reasons. It can be, from smoking will add to oligospermia. Smoking
will
influence
their fertility.
It damages spermatogenesis, it damages sperm production.
Right.
Alcohol in excess, of course, alcoholism will also impact their ability of sperms of reproduction, and infection is very rampant in Pakistan. There is this low-grade infection in almost in every case we see, which is one cause of, it can be sexually transmitted infection, it can be otherwise, but this is one of the biggest reason we find in every case for male infertility. Male facing infertility because of their sperm quality.
Right.
So rest are, of course, there are multiple other reasons which can be congenital. They can have azoospermic, sometimes obstructive and non-obstructive azoospermia. But as these are difficult cases, azoospermic coming. But if they have, we can find out very conveniently if there is an spermatogenesis process going on. If the process is going on, then we can extract sperm out of their testes, and they get fertile equivalent to in the same percentage as the healthy couples with normal spermatogenesis. There is no difference. Now, for instance, even micro TZ, micro testicular aspiration has started, which is a very fine needle biopsy you do without damaging the testes, and you can take out the sperm. So technology is advances. So the causes for male infertility are generally they should keep healthy, they should ensure that their testes are the natural message is there that the spermatogenesis will occur in lower temperature than body. So they should not wear tight underwears. They should not act or wear any clothes or
that's restrictive,
and which will increase the temperature of the testes. And such people are prone to be affected because of their professional hazards. I think that will be those who are driving rickshaws or the drivers who are too long driving every day as a profession, and exposure to chemicals in the factory. They can all add to, pesticides also affect male infertility.
Right, okay. So again, this is all about awareness. So, the media can do so much here, can it not? Giving out information, special programs as well, and people are hooked onto many sort of soap operas and dramas and things like that. These messages can be given out in a subtle way there as well, and especially when we talk about the male approach towards infertility, so that we can give that message there as well.
Yeah, of course. I think that's much needed, and programs like this you're conducting, they're one of the way to disseminate knowledge and information, and the very effective tool probably, and I'm happy you have done this program. Similarly, females before marriage, I think they must undergo a small fertility assessment test, which is composed of 3 blood tests during their menstrual period and an ultrasound, and that can exclude easily about any problem with them. And but I think if they're regulating regularly and the weight is all right, they probably will not need it on the safer side. But still, it's not bad to have an ultrasound
to have
done.
that. Okay. So after getting married, how long should a couple wait before they come to see an infertility specialist? And how do you define a couple for that they need help now? How long should that time period be?
Now WHO has given a definition of infertility that's brought down to 1 year.
1 year.
Yeah,
okay.
1 year. If you are married happily, having a normal married life,
and you're trying to conceive,
and yes, uninhibited, without any caution or anything, you're having normal marital sexual life, you're enjoying that. If you're unable to still not conceive after 1 year,
that is when
then you should worry. And there can be 2 further classification in that. If some of them, when they will report for clinical assessment of their infertility, there may be a female cause can emerge, or a male cause can emerge, or both can be
needing treatment.
So it can be scenario like this, and there can be another scenario that both are okay.
Ah, now that is a very interesting point.
Yes.
That is a very interesting point.
Yes.
What happens there then?
Yes.
Is this about then stress? Because we do hear many cases of when a couple are okay, they've had the tests done and the doctors have given the all clear that there's nothing that seems to be wrong, and they're trying to have a baby, and then, when they think, okay, it's not happening, they adopt. And as soon as they adopt a baby, the wife gets pregnant. I've heard this so mmany times.
Yeah, I think adoption would be a very extreme step and should be after very long consideration, unless they've been told that is not possible. Probably, I think it's very interesting to discuss a case which of unexplained infertility. Unexplained infertility. The first question comes to my mind is that maybe they are not aware of process of evolution, and journal public doesn't know, journal girl doesn't know, the male partner doesn't know that what is the life, how does an egg emerge in a female's body, and when does it come out from the follicle into the fallopian tubes, and how long will it be alive, and when will it be alive? In a month. So it is only one day in the entire month, and it is, the life is 24 hours.
Right.
Okay. That day, husband and wife have a quarrel over some issue. They don't meet. They don't. So the month is gone. Okay. And similarly, that particular time, who is going to tell them that now?
Because in the West, that is something that is taken into huge consideration, the ovulation process, and when a woman is ovulating.
Yes, I think we must educate our girls who are married, who are trying to conceive. They must understand how is their ovulation process takes place. So, and that particular day they can find out without going to doctor at home, their body temperature will change, and they can feel that it is probably they've ovulated. But the good news is that the sperm life is 72 hours. So it's a period which gives you about 4 days, three days at least for fertilization and development of an embryo which can be implanted and a birth can take place.
Right, okay. Yes. Unfortunately, Dr. Sajjad, we've run out of time. There's so much to talk about, and all the advice that you have given the viewers, I'm sure is going to be so helpful for them. Just before we go, a short message for everyone watching.
I think the message is that infertility, dilemma of infertility, do not suffer from it, as it is said. In a recent study from Harvard, it has been declared as traumatic, as distressful, as agonizing as cancer. So deprivation of a child is very acute matter, and please do not hesitate, seek help. There is, I'm sure, 99% you are treatable, and God wants you to have child. You are created for that. The female partner is made for that, and only a blessing of a child brings happiness and makes the bond of marriage, strong. So don't wait. Seek treatment from the right quarters. Go to the specialized centers, tertiary end centers who are only dedicated to infertility and infertility specifically. They are the ones who can help you.
Right, okay. Thank you so much, Dr. Sajjad.
Thank you very much.
Okay, and with that wonderful and hopeful message, we come to the end of today's program. There's always light at the end of the tunnel, as Dr. Sajjad said. The main thing is to, get yourself sorted, to be in the right place. If the right people are treating you, then they will be able to tell you exactly what's wrong and where you need that help. So until next week, stay happy, stay healthy, bye-bye.